For EMTs, you have to actually sign your sign-in form below your name there. So please do that before you leave if you want CE credit.
And that's the same with RNs, we have that, and we have a sign-in fee.
Hi everybody, my name is John Valley, and I was an OBGYN doc at Kaiser for 30 years, and then I retired about 5 years ago. When I retired, I didn't want to have anything to do with OBGYN anymore. So I joined the SMRC, and I found a really great home and an opportunity to be able to do stuff other than pap smears and, STD checks. So this is a lot better fun, and I've really enjoyed it. One of my interests is wilderness medicine, and I was thinking about how wilderness medicine kind of relates a lot to, what we do here in the MRC. And after going through a couple of courses, I felt much more comfortable with some of the things that we do at the first aid tents. And I thought that it would be a good opportunity to pass on some of this knowledge to all of you. So I'm very excited that you're here. And I would like you to, we're going to have an evaluation, we're going to have a quiz and an evaluation. And the evaluation, if you can go ahead and give us true, honest feedback. If this is something that you'd like to see more of, there's going to be much more things that we can cover in terms of specific diagnoses, a little bit more about the whole system of what you do in terms of evaluation and planning and evacuation. So all we have time for today is to kind of really introduce the topic and to give you a couple of general principles on how to take care of patients. I want to introduce my other trainers here. We have Lynn Sattler.
So the other day I was looking through my scrapbook and I found my very first Red Cross card that I got on my 12th birthday when I was old enough to let me work in the hospital. So I've been interested in this for a long time. I grew up on a farm. We had one doctor in the county, no doctor in the hospital. Back then they let you do that. And if you got hurt, you had to figure it out. Baling twine, we've sewn ourselves up, we've done what we have to do. So I grew up with what would be sort of classically wilderness medicine. And then I went on with my life and kind of forgot all that until I retired. And I have been Deputy Director of State Parks and Director of Boating and Waterways. And in Boating and Waterways, I was responsible for overseeing the programs to teach boating and waterway safety and other activities, including comprehending criminals, etc., related to boating and waterways. And so I got kind of interested again, and when I retired, I started working with a local CERT. And then I took their EMR course. EMR is basically EMTs without an ambulance, which is what wilderness medicine kind of is. And then I wanted to know more, and I went back to school and became an EMT and started working with MRC. And in that capacity, it is this aspect that continues to interest me and causes me to keep coming back and volunteering. Oh, and yes, I should say, I am an instructor both with ASHE and with American Red Cross in EMR response and wilderness.
All right, thank you. And Steve.
Hi, I'm Steve. I'm with Medical Reserve Corps. I'm one of the trainers there. I became an EMT about 20-odd years ago when I was mountain biking up in Redding because I thought it was a good skill to know. That branched into ski patrol, where I became an instructor trainer for 10 years up in Tahoe. I really love the wilderness and hiking, and there's kind of a magnetic force that happens once you learn that kind of wilderness training. You tend to stumble across stuff when you're out. So really glad that you guys are here learning this. This is just the introduction. We hope to do a lot more. And after today's class, if you have any questions afterwards that you'd like to ask, feel free to be happy to answer any questions.
All right. So we're going to go in and talk a little bit about our learning objectives. So we're kind of setting out this idea of learning a little bit about wilderness medicine. What is it all about? What are the differences between urban medicine and wilderness medicine? How does it apply to your day-to-day? How does it apply to the things that you're going to be doing in real life? We're kind of breaking it down into 2 simple skills that we really want to get through today. And those 2 skills are the scene safety, scene size up, and the other thing is dealing with the life emergencies, the life-ending emergencies. And for that, we're going to be learning about the ABCDEs. So those are really the 2 things that we want to accomplish. We want you to really be able to go to a scene and be able to suss it out, figure out what would be safe to go after, what you can do, how you can take care of yourself, and take care of the people that you're going to help. And we also want to have you be able to attend to all those life-ending emergencies, recognize them, and try to deal with them. We're not going to give you all the specifics on dealing with all of those emergencies, but we want to just reinforce that these are the first 2 steps that you have to take when you're dealing with a patient. The other thing that we're going to do here is we're going to have a little bit of practice and interaction. So in order to kind of drive those skills home, we're going to actually see a demonstration of our little team performing those 2 skills. And then we're going to go ahead and at your seats, we're going to have a little bit of role playing so that you each get a chance to practice that. We figured with all that, you know, the learning, the principles, the idea of seeing a demonstration and then actually doing one of those role plays will have you on your way to at least thinking about the concept of wilderness medicine each and every day when you go out and about in the real world. So we have to always do disclosures. I want to let you know that nobody in this group has any vested interest in any of the procedures or the medications or processes that we're going to be recommending or practicing today. We do use a model that's been used quite a bit through the NOLS system. That's the National Outdoor Leadership School, and they're very, very good. If you ever have a chance to take one of their courses, I would highly recommend it. We do have a vested interest in people doing better in medicine, and that's why we're here. I love working with SMRC. It's a group of people that are volunteers, and we're very interested in helping people. We're not getting paid. We just do this because we want to. And I know that each and every one of you, if somebody was in trouble or is having a problem or an injury or is ill, you're going to be one of the first ones to rush to those people. And so we're hopeful that knowing a little bit about wilderness medicine will kind of give you some confidence and some ability to be able to handle those particular activities. So if you're taking care of somebody who's in the hospital, you have your own set of protocols and things that you're kind of used to. So many of you are nurses or EMTs, work in an ambulance, or you work in a clinic or an operating room or wherever it is that you work. And you have a lot of stuff available for you to work with. Not only do you have equipment, and sometimes it's the state-of-the-art, best equipment available, but you also have people. You have many resources. It's a resource-rich environment. When you're in an airport, or if you're on the airplane and you're going from Los Angeles to, say, New York, you probably don't have very much available and probably don't have any room to even take care of things. And so your resources there are going to be much, much less. Maybe they have a first aid kit. Maybe they have a defibrillator. You don't even know. You're going to rush to that person and you're going to assist and you're going to aid that person, but you may not have what you need. So the idea of wilderness medicine helps you to at least get there and to try to do something. And it gives you a paradigm, a way of thinking about something that might be a lot more useful to help that person. And in many cases, you may even solve the problem. So the idea of being out and about in the real world means that sometimes you're not necessarily close to a secondary facility where you have a hospital or you can go ahead and do more care. You may have to start thinking about, okay, I've got this situation. You didn't cause it. It's just something that happened. You're just trying to help. And so then you go through your differential and you figure out what it probably is, and then you make a deliberate decision on how to get this person out of where they are and into a place that can take care of them better. Failing to do that, you make the best with what you have at that particular time. So it's really another way of just thinking and creating, a usable plan in order to help people. The situation that most of the time we find ourselves in with SMRC is first aid tents. And first aid tents are kind of a hybrid, and I just wanted to give my fellow trainers a little opportunity to talk about some of the experiences that they've had in the first aid tents or out and about in their real world, and how did they handle those particular cases. Lynn.
So I have been first on scene several times. I don't know why. It's actually one of the reasons I went to school, because I show up when the car flips in front of me and goes down an embankment. And I've been on river situations where people were severely hypothermic and many other things. But one of the ones that I thought of recently on first aid tent was a person had something in their eye. It appeared to be impaled in their eye. And we didn't have one of those guards that you put over it, but we needed to cover it clearly. And we found out that those red beer cups, you know what I'm talking about, those plastic beer cups, they make them in shot glass size. Perfect for putting over the eye and cream. So it was, it was one of those things where we didn't have what we needed, but it was going to be important to do something. And that's how we adapted it. So that's just one example of it. You don't want to go all MacGyver, but it's an example of going a little bit MacGyver and figuring it out.
That's great, thank you. And
drink the shot.
the red Solo cups.
Yeah, Solo cups, that's what
They have a song about it.
So one of the most medical events that we have done recently in the Medical Reserve Corps is a bicycle motocross race.
Oh, yeah.
We had a lot of very severe injuries at that race. People are bicycling at high speeds. A number of the bicyclists went over the handlebars and hit their head. We had 3 or 4 people that were unconscious and posturing during that. Now, we don't have the equipment to deal with that. We got defibrillators, we got oxygen and so forth, but we have to be able to recognize this is an emergency call, right? We can't treat that, we can't check their brain for bleeding, we can't check for internal bleeding. So we have to understand right away, this is an emergent call, they need an immediate evacuation. We stabilize the life signs, and we'll go over how to check that shortly and do that. So we get them on a backboard, we package them up, we get the fire department there, we get as much information as we can from family, and we pass that on and get them down to the hospital for definitive treatment.
Okay. Well, thank you. The Next part of it is one of the two main teaching points, and that is the scene size up. And we're going to give you some little goodies here that are going to help, number one, be something that you can take and just put into your pocket. We've got a couple of sheets that we've already started, and you can see that it's one of these types of small little notebooks that you'll be able to keep in your pocket. And we're going to go over a couple of the pages today, but I'm hoping to go over more pages, and I'm hoping to have even more classes about another specific diagnosis so that you feel well equipped to handle almost any emergency that comes your way. The scene size up will then be presented by Steve, and he'll talk a little bit about what the components of the size up is and how to remember it.
Thank you. So I have a tendency to talk real soft, so if you're not hearing me, give me some kind of sign. Let me know I need to talk a little louder, okay? So I put these together in a hurry. They're not very pretty, but the information on it's really good. So we're going to do the scene size up. You can see that on the very first cover of this. We lost a couple of ski patrollers a few years ago. It's kind of a dangerous profession. There's avalanches and storms and things like that, but this was very unusual. They were setting up something up on the hill after a big storm, and one of the patrollers fell into a very, very deep hole, like 12, 15 feet, and went immediately unconscious. And the other patroller that was there dove in after him and went immediately unconscious. And then more patrollers started coming up, and they forgot the very first thing about responding to these emergencies, which is your scene size up. What was going on was there was some kind of poisonous gas in that hole that was very fatal very quickly. And they lost 2 patrollers because of that. They didn't stop to think. So we got to be careful. We got to look for hazards that are around there. What's the traffic like where we are? Am I in danger on a highway or on a bicycle path or up on a trail where there's horses or bicycles? What's the weather like? Is there a lightning threat? What is the lighting around? Can I be seen by other people and other vehicles? Is this a crime scene? Is there any indication of violence? Was this a stabbing or a shooting? Where is the suspect? Right? Is it safe for me to come in yet? Is there hazmat involved? Am I smelling something really unusual here that doesn't smell right? Maybe you should not enter that. Maybe you should call 911 and wait for the professionals to come in before you do that. Not get caught up like the ski patrol did. Because if you do that, not only are you not helping your victim, you're creating more victims that are there.
So that's number 1. And the mnemonic devices on number 1. So this is a device to help you remember all of those things that he just listed. Because when the adrenaline starts flowing, here's these perfectly trained, incredibly experienced ski patrol people who should have known better, and they went right in the hole. And so we're Knowles, and we are offering you this to help you get it so into your system that you don't make that mistake. So it's number 1, I'm number 1, okay?
The next thing on scene safety is, for those of you that are not familiar, MOI is the mechanism of injury. That's for trauma situations. Somebody's been hurt. NOI is the nature of illness. It might be a medical issue, not a trauma issue there. So as you're looking at the scene, you're asking yourself, what happened here? Is this a car accident or somebody just fall on the ground? Some other medical kind of problem.
So that's number 2, what about you? So that is, now you focus on yourself, and then you focus on the patient.
Next thing is the number of patients. How many patients do we have here? Some may be obvious, some may not be obvious. Came across this in a car wreck on Sunrise Boulevard. There was a mother in the car, and there was a baby somewhere. Didn't know where. Somebody had picked the baby up out of the car to take care of it, but we didn't know. So you always want to check and get a sense of how many patients are there going to be? Can we handle this ourselves, or do we need to get the cavalry started right away?
And we accidentally skipped number 3, but that's fine. A lot of times things don't happen in great order, but you want to get yourself back to your order, because number 3, which we'll talk about in just a moment, is again keeping yourself safe. But while we're on the subject of number 4, are there any more? One of the other things that you want to learn to do in wilderness medicine is use your bystanders, because you're probably the only trained person there. So you need to learn how to use other people to help you. Learn to use language that is clear. You're not going to be using medical language. Learn to figure out by looking at people who's going to be useful. The man over in the corner screaming, oh my God, oh my God, oh my God, it's probably not going to be your best helper. You probably need the person that comes up and says, how can I help you? And you want to find out from your bystanders who witnessed the event and who might be related to or know the person well that can answer questions should that person either not be conscious or loses consciousness. So as you're looking, are there any more? It's not just more patients, but it's also more help. Go back to number 3.
So we're forming a general impression of what's happened here and what do I need. I like the fire department has a saying, take 5, stay alive, meaning stop before you enter, count to 5, take some deep breaths, look around, get that general impression formed before you go rushing in. And then the last part of that is, once you form that general impression, what other kind of resources am I going to need here?
And we left out number 3, which is your PPE. How many of you, when you go on a hike, have a pair of nitrile gloves in your pocket? Okay, so the rule that you always use in the hospital, right? You never touch base without gloves. Can you touch the space without gloves? You're going to have to make that decision. A lot of those kind of rules are not going to apply. If you need to put some barrier on, you can get really creative and use a sock. There's a lot of things you can do, but just be aware, you're probably not going to have the same PPE that you're used to. You probably don't have a mask, right? If you have glasses, you can put those on. That's good. But just be aware that you're going to have to suspend a lot of those PPE rules that you have in a hospital or a controlled setting if you're going to be able to help the person.
So now that you've heard it, we can put it all together, okay? So we're going to have a cheer and response thing going on.
So yeah, because if you say it, you'll start to remember. Number 1.
I'm number 1.
Number 2.
What about you?
Number 3.
Nothing on me.
Number 4.
Are there any more?
And number 5.
Dead or alive.
Cool. You passed that one, okay? I want you.
There's only 2 things you had to know today. That's one.
So any questions on the scene size up? How many people in here are medical by raise of hands? Oh, quite a few. Okay. All right. Okay.
All right.
Ready to move on?
And,
ABCs?
let's go ahead and
Okay, so we've done those steps and we've made a decision that we're going to go help this person with whatever we've got. That's where we are.
So this is all going to be very familiar to you. I'm sure you've come across this before. What might be helpful is I want to describe how in ski patrol we do this, because we typically get a call and we got to go find where the patient is, right? And so as I'm coming up on the patient, I'm doing my scene survey, I'm looking around, what happened, here, right? Am I in a place where skiers that are coming down the hill can see me? Do I have to make the scene safe so we don't get hit? Are we on an edge, something like that? Lost my train of thought. So I'm walking up and I'm assessing all this, and I can talk to my patient at that point, right? I can say, hey, I'm Steve, can I help you? I'm getting permission to contact the patient.
And that's especially important too, because not being in a medical setting where they came to you, you're going to them. They don't know who you are from nothing. That's different than being in a hospital or even a med tent.
So I'm Steve, I'm an EMT, or I'm a nurse, or whatever your particular licensing is. Can I help you? If that person responds to me,
Yes, please help me, please help me.
now, I already know some things about their ABCDE, right? I know they got an airway, I know they're breathing, I know they have circulation, right? And I know they're at least minimally coherent and responding appropriately. So that's good, that makes me feel a little better right off the bat. So disability is a big thing. It stands for spinal or neck or head involvement. When I have to worry about moving or manipulating the patient that's there. So I might continue to ask a couple of questions just on my way up. Can you remember everything that happened? Tell me what happened.
Well, I woke up and my leg really, really, really hurts.
Okay, so they have memory and they're coherent here. So that's another good sign too. They may have some other issues that I need to check out further.
Oh, you had loss of consciousness.
Yes. And then E, that's changed a little bit over the last few years. So exposed means we want to expose all the body and look for all the injuries or things that may be medically significant as appropriate, right, for the weather and for the situation that's there. We have to be aware of the environment. If I'm out in the cold and the rain or the snow, I got to keep my patient warm. If I'm out on 110-degree Sacramento days, I got to keep that patient maybe cool and in the shade. And we tend to forget that in lieu of the more salient kind of things like complaints of pain and bleeding and things like that. We may also make a decision about, does the situation require specialized evacuation? Is this a car that's upside down? Is there somebody over a cliff that I can't manage? I need to call specialized fire department people to go do this. Is there going to be an extrication from that car? And is there going to be a special evacuation needed, like by helicopter? Because we're not in a place where we can drive a vehicle to. So these are all kind of things I want to be getting in my mind as I'm assessing this.
So when I saw that car flip and go down the embankment of the Tahoe, and my husband and I were bushwhacking our way down the hill trying to find the car, and really aware, I mean, we didn't have any cell coverage. I don't even remember what happened with their cell phones, but we're thinking, should we both go down? Should one of us stay up and try to flag a vehicle to drive to somewhere to call? You don't even know if the people down there are alive. You have to begin thinking in ways that you don't think about in a non-wilderness situation, because, and on the way down, you're thinking, well, probably things broken. Here's a good stick. Let's walk down with this good stick. You know, who knew there was a good stick? You know, or when you jump out of your car, do you grab the blanket and some other things because those might be helpful? You have to look at the environment and begin to imagine what you might need, and knowing that there may not be any of that down there. You may have to take it with you.
So last thing I want to say about this, we're looking for things that are going to kill your patient quickly right off the bat. And so this assessment should be done fast. Anything you find that's wrong, you stop at that step and address it. So if their airway isn't open, we open it. If they're not breathing, we breathe for them. If they don't have circulation, and that's including blood loss, right? We want to address massive hemorrhage right away. You can usually see that when you're going up there. and we may do CPR. So wherever you get a hit and there's a problem, we stop right there and fix the problem before we move on.
And in a wilderness situation, you have to make decisions. Do you start the CPR, or do you try to flag somebody down and get the 911 call made, and then do the CPR? I mean, there's all kinds of considerations that you have to take into account while you're in a I don't say a wild situation.
We have a question?
Are you going to talk about protecting the neck?
Yeah. So that's part of that's part of the very first thing that you do. So it's the mechanism, when you have the mechanism of injury, you get an assessment as to what the likelihood of a neck or back injury is. So remember the 1, 2, 3, 4, 5, number one, I'm number one, number two, what about you? That's where you're starting to think about, the mechanism of injury. If you think that it's a high likelihood of a neck or a back injury, you need to take appropriate steps to protect the back. I think it'd be a good time for the chain.
Oh, okay.
And remember that here under D, disability is the place where you actually stop and decide about the neck and the back. You're assessing all along, but that's your point.
Right, so the system, if you practice the system the way that it's written, 1, 2, 3, 4, 5, A, B, C, D, E, you're not gonna, it's a system so that you're not gonna miss anything. So, number two, what about you? I already started to think that maybe this is gonna be a back or a neck injury. So then when I get through my scene safety, I'm going through my A, B, C. D is disability. It means a couple of different things, but number one, what it means is, do I have a disabled neurological problem? Is that something that I'm going to have to protect? So Steve has this great demo here.
Well, I'm going to use Lynn first here just to show something. Again, with a medical audience here, you're probably familiar with this, but just to cover our bases.
Is this good?
Are we going to be able to get you back up?
Yeah, heck knows. That'll be our next wilderness experience.
So part of our examination, we're not going to go into treatment today. But the examination, we want to examine all the parts of the patient. People often forget about the back, right? It's there. And a lot of times, all the training material we see, all the wounds are always on the front, right? You never see like a second adjustment on the back on any training. So you want to check everything. But you have to be very careful. And the comment about the neck was really good. I know backboards have kind of fallen out of favor recently. But we have to be very careful about moving the patient, right? So if we want to roll them over, we don't want to twist them while we're doing that. We have to be very careful with that. Also, if we're going to drag them like out of a dangerous spot to a safer spot, we have to be careful. I think I changed my mind. Let's bring me back up here.
Oh, my. What did I do?
So, this is your spine on the floor, and we have to move that patient. If I try to push the patient to the side or roll, I'm going to deform that spine, right? I can't really avoid that. That's really bad. We used to do this a lot in terms of getting people on the backboard and repositioning them on the backboard, and people would push them sideways, which is not great, but the same thing applies if you're moving a patient out of a dangerous situation or a place or off a chair. You can see if you roll the patient, you can also twist the vertebra as well. But you can move the patient longitudinally if you pull in a direction either way, and you're keeping that spine straight. So we have to keep this in mind when we're manipulating the patient, whether it's putting on a splint or changing their position. So, makes sense to everybody?
So we're handling the idea of a back injury right at the beginning, that's number two, thinking about the mechanism of injury. If the mechanism of injury is somebody just, tripped and, fell on the ground on his knees or his hands, then the mechanism of injury doesn't speak to a disability in terms of possible injury to the back or neck. Then on the ABCDEs, you deal with it again. If it's a low risk, there's going to be a step in the secondary assessment that you're going to go ahead and work at in order to rule out a back or a neck injury. And we're not teaching to all of that right now. We're teaching to the 1, 2, 3, 4, 5, and the ABCDE. Okay? I think it's time for cheerleading.
Yeah, well, I was going to just say one quick thing about that is, but you do have to check the back. So if you're there, if you're the medical person, who might help you line up down that patient to turn them correctly? Come on, think of your numbers. 1, 2, 3, 4. What would 4 be?
Are there any more?
Bystanders, okay? So that is something that bystanders can learn. If you've got 5 people, you can turn somebody and maintain spinal and neck care. If you're by yourself, you're going to be just kind of scooting your hand in there and see if it comes back wet, But just remember, if you got more people, you can do more things.
So you want to lead us in the ABCDE?
Okay, all
I think we
right.
have a question
Okay,
first.
Oh, I'm sorry. Do we have another question? Yeah.
So, sort of follow up on George's question, if there is a change in level of consciousness,
Yes.
you come up to someone and they can't really tell you,
Right.
say they're talking, but there's obvious just deficits that they can't tell you if they hit their head or not, or if their neck hurts. Is that enough to assume, okay, we're stabilizing the neck,
Yes.
this person's not
Right.
moving?
Yeah.
Or injury to a helmet or something.
To rule out a back or neck injury is a whole class. So we can teach to that. These are all really great questions. But you have to assume a back or neck injury until you've proven otherwise. And there is a way of reliably proving that, but it does involve level of consciousness. So you have to have a complete level of consciousness. You have to be alert and oriented ×4. If you're not, then you're absolutely correct. You cannot rule out a back or a neck injury or a head injury. And so you have to assume that they have it. Exactly.
Okay, everybody, cover your eyes. What is the mnemonic device we use for the initial assessment? Just holler it out.
A, B, C, D, E, yeah.
A, B,
Breathing.
C,
Circulation.
D,
Disability.
E. Okay, say that one again.
Yeah, well, E can be a couple of different things.
It can,
But
so
it's really
expose.
expose the life ending injury.
Yeah.
Okay. All right.
Consider the environment and-
Next slide.
Yeah, we're going to move on to more stuff that we're not really going to talk about. So you know that you have the first and second thing that you're going to do, and that's what we're trying to learn today. And that's the 1, 2, 3, 4, 5, and the ABCDE. After that, there's going to be a variety of different approaches because we're all, we've all dealt with patients in our life, and so we have some experience with that. So we're all going to have a history that we're going to take and a physical examination that we're going to do. And we're not going into detail on that tonight, but just let it pass to say that that's the next two things. And you have to do those things in order to take care of the next problem, which is going to be making an impression and an assessment, trying to figure out what the diagnosis is, and then the last thing, of course, you're going to do is you're going to have a plan a plan to evacuate the person, to get them out of there, to treat them and get them on their way, to discharge them, whatever it's going to be. In the wilderness, I'm just going to tell you that there's a lot of special precautions and special considerations, because a lot of times you may not be very close to where it is going to be the person can get more help. So you're going to have to figure out how are we going to transport that patient. And if you have somebody who's got a disability that determines that they may in fact have a neck or back injury, you're going to have to put them on the backboard, and you're going to have to transport them a very far distance. And that's where a lot of logistics come in, a whole big problem with evacuation issues, search and rescue may have to be called in. There's a lot of things that go into that, including communication and how do you even tell somebody what the problem is? How do you get a hold of somebody if you don't have any cell coverage? So there's a whole host of other issues that have to be gone over. But that's not the purpose of this class. The purpose of this class is to get those two basic things. Because if you can stay safe and you can approach the patient in a safe environment and start to get them comfortable, and if you can attend to life-threatening emergencies, you're going to be in a much better set of circumstances to be able to help this person, okay? So what we're going to do now is it's always good to kind of practice these sorts of skills, especially to kind of reinforce them, to make sure that they really become part of your everyday lexicon. So we're going to go ahead and do a demo first, and then we're going to let you each kind of pair up and try to go through the two basic principles on your own, okay? So we're going to go ahead and set up a scenario. The first one, I will be the patient, and Lynn and Steve will go ahead and be the responders, and they'll go ahead and reinforce with all of you by going through the 1, 2, 3, 4, 5 and the A, B, C, D, E's. So I'll give you the scenario. This is a 70-year-old male, and he is in the last couple of miles of the Western States 50. He's been running a good race, and all of a sudden the patient falls off to the side of the trail and lands kind of gently into the tree and the moss and the grass and the various foliage that's in there. It happens that it's towards the end of the run, and there are two SMRC volunteers there, and they see this guy fall off, and they're going to go ahead and they're going to come to his aid and help to figure out what's going on. Okay?
Okay, so we see him fall, looking around, it's in a race. I don't know what the exact geography, are we on a hill, are we on rocks? Is this a stable place? Are we around a blind corner? I'm evaluating the situation to see what's there, and are there additional runners or anybody else that may be a hazard in this place? So we're going to secure the scene first before we go in.
So what's that?
What about me?
Right.
First, number one.
I'm number one.
Okay. I don't know really if we're dealing with a mechanism of injury, if you trip or if you just collapse yet. So I'm keeping that in my mind. Is this a medical thing or a trauma thing or a combination of both?
Rattlesnake.
I always carry close with me, so I'm going to use my PSI that I have right now where they're in there. I'm only seeing one possible patient here. And I'm gonna, can we scare you?
No, I was just laughing, because I do have books in my pocket. Here you go.
Hi, my name is Steve, I'm an EMT, can I help you?
Oh, yes, you can. I don't feel good.
Can you tell me what happened?
I was running and I tripped. This is a long race.
Very long race.
It was like 40, I was like at 48 miles, and I think I just got tired and I didn't pick up my feet well, and I tripped out on a rock, and I fell down.
Okay, what have we covered of the ABCD?
Airway, breathing, circulation.
Breathing.
How about his mental status? Got good recollection and speaking very well. Do you have any pain in your head, neck, or back?
No, I think I landed on my knees, and my shoulder hurts a little bit.
Okay, great. Left shoulder hurts and which knee?
Both of them, but the right worse.
Right is worse. Okay. Also scanning for blood. I'm not seeing any significant bleeding that's here.
And I'm his partner, I'm looking around on this side because it's conveniently exposed.
And so I can ask him also, do you feel like your body is wet anywhere?
No, it's, I think the grass is wet over here, but I'm not sure.
All right. So, do you have any sense of what's going on with you? Have you been ill before?
No, I'm pretty healthy. I was doing a 50-miler, and I don't have any medical problems. I'm allergic to aspirin.
Are you taking any medication currently?
Not taking it.
Any drug use or alcohol use today?
No.
Okay. All right. And so we're starting to form an impression.
And I say, I want to just relate this to you. So we've got A, B, and C. And now he's starting to ask him about what parts are working. So we're looking at, what are we looking at?
Disability.
Disability. Okay. Go ahead.
He moved his legs while we were talking.
That's right.
Yeah, I don't feel very comfortable on the ground.
Would you like to sit up? Would that be more
Yes.
comfortable for you?
I think I can move just fine. So, here we go. Yeah, okay.
Do you feel better than you felt a few minutes ago before you fell?
Yes, I do. Thank you very much. I think I want to finish the race.
Do you
So-
think we might want to ask about water?
Yeah, I'd like to have some water.
Yeah, I just wanted to say, we actually had a case just like this at a race a little while ago where a man was running a long race. It wasn't terribly hot that day. He, according to the witnesses, he fell right before the finish line. It was kind of fuzzy, got himself up across the finish line, and then went completely unresponsive and was hyperventilating and sweating profusely. He was unresponsive to pain, verbal stimulation, any at that point. So it was very kind of similar, except he wasn't anywhere near coherent. So we knew right away that was going to be a 911 call, and we started him on oxygen, and there was actually a defibrillator there that had a monitor on that. So we were very lucky in that case, which is probably not going to happen with this thing. So this kind of thing is very common.
Let's talk about E, because it was included in this, but not specifically drawn out. So E. Expose. He didn't remove anything because he didn't do what?
There's nothing on the
Yeah.
review.
Right. And environment and evacuation, he will be leaving on foot. Is there anything else we would want to say to him related to E?
The other on E, you should think of, you should make his personal environment a little bit more comfortable. So if they want to sit up, let them sit up. If you have a jacket or a pad or something, that you could put underneath them, because oftentimes they're either on the snow or in the wilderness. You want to go ahead and try to make them a little bit more comfortable.
And different people will do this in different ways. Personally, if I had a 70-year-old that fell, I would be a little more concerned, and I would want to do my secondary survey and palpate and make sure there wasn't something else that would make me really worried about moving him away, etc.
I want to know if he hit his head and if he was unconscious before waking up. I remember a woman near Montreal falling, just standing there at the foot of the slope. Fell, hit her head, had a lucid interval, and then she went out again, and she didn't, that's a long story. But looking for a lucid interval, especially out in the wilderness.
And did she have a recollection of what happened?
I can't remember, but I know that she died on the way to New York, because they didn't think Montreal could take care of her.
Yeah.
Well, these are all really great questions, and I hope we'll be able to work through a lot of these answers in the next couple of months. Okay. All right, we're going to go ahead and give each of you a little practice at this. And remember, the goals of the training is to kind of get through the 1, 2, 3, 4, 5, and the A, B, C, D, E. And the way we're going to do this, have you start with 1, and then you go 2, and then keep on counting 1, 2, 1, 2, 1, 2 until we get through the whole. Go ahead.
We're number 2.
2.
Could be.
2.
2.
Actually, 1, 2.
1.
1.
2. 1.
2. 1. 2.
1.
Okay.
In the back?
Okay.
Okay, 1 and 2, okay.
All right.
Who in here is non-medical? Okay, just you?
Over here.
Okay, great. Do you guys want to pair up, or do you want to go with a medical person?
Either way is fine.
Okay.
Okay. So go ahead, everyone pair up with the 2, and then we'll go ahead and I'm going to give you a scenario, okay? So move around your sheets if you need to do that. For the first, so you choose one, and then you're going to be the patient, and then the other person's going to be the provider, and then we'll have a chance to break, and then we'll go ahead and you'll switch roles, okay? So the scenario that I'm going to give you is a soccer player at the community, you're at a community event, we're the MRC team there, and the kids are like they often are playing soccer on a field, and it's really hot. It's about 102, 103. The sun is out. It's August in Sacramento. Just perfect weather, huh? And the soccer player is just really starting. People have noticed he's starting to miss the ball when he's a good player. He doesn't want to drink. He's not doing anything. He's just very lethargic. And then he starts to not really understand, where he is and what he's doing. He's kind of disoriented, and he looks dry. All right. So that being said, I want the one person on the team to go ahead and assume the role of the patient, and then the other person's going to approach them at their table side and go through the 1, 2, 3, 4, 5 and the A, B, C, D, E. Okay, and then after they've done it once, they can go ahead and switch, and we won't go into the assessment or the examination or the plan or anything like that. Okay, so we'll give you about 5 minutes just to do that on your own. because this is kind of the first time we've done this. I used to do a lot of training at Kaiser. I did simulation training for OB emergencies. So if you want to know how to take care of a postpartum hemorrhage, you want to know how to do emergency C-section, you want to take care of a preeclamptic or eclamptic seizure, a neuro event, I can help you with all of that. And I actually have simulators for all of that. This is a little bit different, and so we're all learning together. You know, when one of the things now that I'm in retirement, it reinforces the fact that every day I wake up and I wake up to teach and to learn. And so this has been really a great experience for all of us in terms of being able to teach and to learn. But things must come to an end, and but before the end, there's always a test. So we have a test we're going to hand out to you all. For those of you who are getting CEs or credits, this is part of the evaluation. For those who don't get any credits, like the doctors, you're just doing it because you want to. Okay. So we'll give you a couple minutes to do the test, and then I think we'll go through the answers all together so everybody knows that they did well. Okay? Correct them yourself, and then we'll go ahead and the people who are not EMTs who don't want credit, you can just hang on to your test. But the other people will have to put it on the desk on the way out in order to get credits. Okay? All right, let's go over this all together. So, which of the following is the most appropriate initial consideration when encountering a patient outside the medical setting? What's the answer? C. Size up the scene to ensure your safety as well as the patient and those around you. Any
1, 2, 3, 4, 5.
Right. Any questions about that? All right. We talked to that one. Okay. In the ABCDE protocol in wilderness medicine, what does D represent? C. Deciding if the mechanism of action of injury means that the patient is at risk for spinal injury. All right. Establishing scene safety, how do we respond to lightning? This is not taught, is it? What do you guys think? Okay. What do you know?
I go on top of a hill and put them next to a metal fence.
All right. So we didn't talk about lightning at all. That's not really a fair question. But the answer is go indoors if possible. We should, I think lightning would be fun, wouldn't it? We should do a class on lightning. All right. And then number 4, in ABCDE, C stands for circulation. And what does that refer to? D. And D, all of the above. Major bleeding, limbs are being perfused, and the heartbeat's normal. What is the evacuation plan for a patient with cardiac arrest that has had successful CPR? Be transported as soon as possible to a hospital. Okay. So, what was that?
Now, before you transport, if you have the ability, why wouldn't you start, and if it's within your skill set, why wouldn't you start an IV? Because you want to have vascular access space.
But that is the point on
It's not evacuation, but that's the first step in planning.
Yeah, if you have that, it's in your protocol, that's all great.
If you have it with you.
And,
You
yeah.
carry it with you on your hike.
I don't carry IVs with me.
Yeah.
And how legal is that if you're?
But I would give max
currently
credit.
If you have it.
Yeah,
medical supplies.
It would not be legal.
But
If you,
it's not the evacuation. Evacuate means get out.
yeah. All right, so go ahead and score, certify that you did the test by yourself and that you got your passing grade, okay? All right, so just final summary is what we hope you took away from this training is that wilderness medicine is different. And because of that, you're going to have to think more critically about what you're doing and how you're doing it. You know, it's always important in any kind of medical setting, you know, to sort of have a protocol, an approach, a way of handling patients. But in a wilderness environment, it's really critical because, you know, number one, it is and it can be a very unsafe environment. You're outside, in the outdoors, things can be bad. There can be lots of ways that you could get hurt. Don't get hurt. So scene safety is really, really important. Don't just rush in and boldly go where no man has gone before. Rush in with thinking about the 1, 2, 3, 4, 5, and then go ahead and help the people. You know you're going to do that, and so I hope that you'll feel more comfortable after this class. When the PA system at the airplane says, is there any medical personnel on board? You can go ahead and just raise your hand, get out of your first class seat, and go back to coach. And lay between the bathroom and the last seat, and take their old-fashioned first aid kit and just do the best that you can with it. Remember that when you are out and about, that your decision about evacuating has to be made on a medically necessary and systematic way. It's a deliberate decision. You can't just be rushing and grabbing somebody or throwing them on the back of a snowmobile if there's any chance that they've got some back injury. You have to think very hard and fast about how you're going to move and transport the patient. And the more we know, the more we learn, the more we have trainings like this, I think the more confidence that you're going to have. So I think if you guys want it, just go ahead and write that on the evaluation, that we want to do more stuff like this. I think the next step would probably be doing something like the secondary assessment, start to think about specific diagnoses and how to actually do the transportation. Okay? Any questions?
Thank you.
Thank you.
Really appreciate your time and attention. Thank you very much.